Today, I want to talk to you about something that is extremely important for midlife women or women between the ages of 35 and 55. They are the 9 symptoms of perimenopause. This is such important information to understand because, as I write in my upcoming book about a cautionary tale, it is so important for you to understand whether you are or are not in perimenopause and differentiate that between premenopause, perimenopause, and menopause. Because if you yourself don't understand that you are in perimenopause as opposed to menopause, you could receive the inappropriate support or hormone therapy. So I'd like to go through this. I have a claims and research section in my Instagram, and this is the claim with the research that I'm discussing this morning. It is called the 9 symptoms of perimenopause, and I've shared this to my story as well, so that you can go back and have a look at that. And I quote the reference articles in this story too. So please, the 9 symptoms of perimenopause are so important for you to understand. If you have 3 of these 9 symptoms, you are most likely in perimenopause. The research-backed diagnostic criteria for early perimenopause. Now, this is based on the most incredible work by Professor Geraldine Pryor, who is now in her 80s. She is a Canadian endocrinologist who founded the Center for Menstrual Cycle and Ovulation Research, and she talks about this in her study published in Climacteric in 2014. So the key finding is a diagnosis of early perimenopause can be made in midlife women who continue to have regular flow if they're experiencing any 3 of these 9 experience changes. So why this is so important is because women will sometimes skip a period perimenopausally. A couple of things happen when you skip periods as well in perimenopause. Not only do some of the symptoms go completely out of control, but women can skip periods for up to 80 days, up to 3 months at a time, and they suddenly think that they are in menopause. So if they go to their GPs and they tell their GPs that they are no longer cycling, right, then the GP automatically believes that they are in menopause when they are not. To be menopausal, you need to have not bled or had a menstrual cycle for 12 months and 1 day. And then menopausal hormone therapy may be appropriate. Prior to that, you are in perimenopause. So between the ages of 35 and 55, if you have still had a cycle or you have not yet gone for 12 months and 1 day without a bleed, you are not yet menopausal. And menopausal hormone therapy is inappropriate therapy for you and can be very dangerous. Back to Geraldine Pryor and the Scientific Foundation. So why this matters. Perimenopause is a highly symptomatic for about 20% of women who are currently inaccurately counseled and inappropriately treated with oral contraceptive, menopausal hormone therapy, or hysterectomy. It is so important for perimenopausal women not to be given an oral contraceptive pill as treatment because this can exacerbate blood clotting. So women over the age of 35 should not be given an oral contraceptive pill for perimenopausal hormone therapy. So this is in the research by Professor J.C. Pryor in Climacteric 2014. So the 9 symptoms of perimenopause, part 1. Symptoms 1 to 5 are the physical changes. So things like a new onset, heavy or longer flow. So if your periods suddenly become heavier or you're bleeding for longer, so you're not just having a 3-day bleed anymore, you're actually bleeding for 6 days. Shorter menstrual cycles, so you're having cycles more frequently. So if they were 28 days, they now might be 24 days or 25-day cycles. Or if you were a 32-day cycle, you're now a 28 or a 25-day cycle. So that's the shorter menstrual cycle. New, sore, swollen, or lumpy breasts. So your breasts are a little more tender than they usually have been, and you're noticing this. You're having new, sore, and swollen tender breasts. This is a sign of excess estrogen in the breast. So this is also so important because perimenopause is a time of estrogen excess, not estrogen deficiency. So we have new mid-sleep waking. So you're fast asleep and suddenly you start to wake in the middle of the night and you can't get back to sleep. This new or mid-sleep waking. And an increase in menstrual cramps. I personally started to experience this. I'd never had menstrual cramping before when I'd had my period, but perimenopausally those were exacerbated. Things like pro-resolving mediators or SPMs can be extremely supportive for increased cramps, increased menstrual cycle cramping. So you only need 3 of these 9 symptoms to indicate early perimenopause, even with regular cycles. So even if your cycles are still regular, if you have 3 of these 9 symptoms, you could be in early perimenopause. So symptoms 6 to 9, neurological and metabolic changes, the onset of night sweats, in particular premenstrually. So you don't actually have to have night sweats all of the time. You can just start to feel this sort of bloom of heat, or your pajamas are just slightly wet, or you feel a little clammy. New or markedly increased migraine headaches. This is very common. New increased premenstrual mood swings. The mood swings and the mood instability and the mood changes and the lowness, all of this is definitely quite common in perimenopause. And then the weight gain without changes in exercise or eating. Now, the critical point is these symptoms can occur even when menstrual cycles are still regular. And then what's really happening hormonally, the hormone reality, the research reveals the following. Estradiol or E2 levels averaged 26% higher and soar erratically during perimenopause. Some women actually describe feeling pregnant due to the high estrogen states. So you can have those tender breasts, that real bloating in the abdomen, and you can feel that same sense of pregnancy in perimenopause with that higher estrogen level, up to 26% higher. Ovulation and progesterone levels become insufficient or absent. The P4, your progesterone, starts to decrease because you're having anovulatory cycles perimenopausally. The most symptomatic women have higher E2 or estrogen and lower P4 or progesterone. So in perimenopause, it is not an estrogen deficiency state. Menopause can be seen as a lower estrogen state. I still don't believe that it's a deficiency state. Lara Bryden talks about the fact that we have evolved to adapt to a lower estrogen state in menopause, but in perimenopause, our estrogen levels are higher than they usually are in our earlier phases of life. So estrogen is erratic. She's extremely high, and it's a real roller coaster. And it is the drop from high estrogen to low estrogen that the brain interprets as an emergency. So that's why you can sometimes feel all over the place, out of it. Your mood swings are crazy. It's because of this emergency response in the brain, because of the way that the brain is sensing the high estrogen to the low drop. So perimenopause is not an estrogen deficiency state. The most symptomatic women have higher E2 or estrogen and lower P4 or progesterone levels. Common knowledge inaccurately says that estradiol levels are dropping or deficient. This is just wrong. Evidence shows that with disturbed brain-ovary feedback loops, estrogen levels are actually higher and more erratic. This is to do with something called inhibin B. So this is a normal physiological feedback loop that is actually broken on purpose in perimenopause so that our FSH goes up, our follicle stimulating hormone goes up, and we produce higher estrogen levels because the feedback loops are broken on purpose so that we don't end up with periods in old age homes, or we don't end up pregnant when we're in our 50s or 60s. So perimenopause versus menopause. Why perimenopause is different. And this is from Pryor et al. In 2023. Perimenopause is hormonally and experientially different than both premenopause and menopause. Those experiencing perimenopause have higher and more erratic and unpredictable estrogen levels, with lower progesterone levels ahead with the premenopausal period. Symptoms associated with perimenopause include heavy or frequent menstrual flow. If you have a heavy or frequent menstrual flow, that is a high estrogen state. If you have sore or tender breasts, it is a high estrogen state. So if your breasts are tender, if you put the flat palm of your hand against your breast and you push them back and they are tender in any way, or when your partner comes to hug you in different parts of your cycle and your breasts are tender, if you are perimenopausal between the ages of 35 and 55, that is a high estrogen state. That is too much estrogen in the breast. That is not an estrogen deficiency state. So these are likely related to specific hormonal changes, as well as the migraine headaches. What the research shows about treatment, key findings about conventional treatments. Estrogen in menopausal hormone therapy will not reliably suppress the perimenopausal estrogen levels. So please do not take estrogen therapy if you have high estrogen levels perimenopausally. So no RCT data have shown that menopausal hormone therapy is effective or safe for perimenopausal vasomotor symptoms. Please know this. Professor Pryor shows this very clearly in her research. Do not use estrogen therapy in a high estrogen state. This is dangerous. Treatment insights. Recent randomized control trial with 189 perimenopausal participants from across Canada. Oral micronized progesterone at 300 milligrams at bedtime significantly decreased perceived perimenopausal night sweats, improved sleep quality compared with placebo. Night sweats and sleep problems are major concerns among people in perimenopause, often starting when cycles are still regular. Perimenopausal therapy, being 300 milligrams of oral micronized progesterone, is very safe, and it is something that can be taken without estrogen. You can take progesterone without estrogen. You cannot take estrogen without progesterone safely. Symptom prevalence from research: about 80% of perimenopausal women experience vasomotor symptoms, or VMS. 25% have menorrhagia or heavy bleeds, which again shows a high estrogen state, and about 10% experience mastalgia or tender breasts. All of these things can be treated with the 300 milligrams of oral micronized progesterone shown in the research by Professor Geraldine Pryor. The complete picture: the majority of women describe varying intensities of sleep difficulties, coping difficulties by and large, and mood difficulties. Women experience things like aggro, mood instability, crazy mood swings, feeling really low. Like I said to you, when estrogen is roller coastering and going from a very high to a very low, the brain does interpret that as an emergency. So we need nervous system support in the form of something like magnesium. We need adrenal system support, and we need to ensure that we're supporting our HPA and our HPO axis. Your brain needs to be communicating as smoothly as possible. P4 and E2, P4 and E2 complement or counterbalance each other's tissue effects. Oral micronized progesterone, or P4, is a physiological therapy for treatment-seeking symptomatic perimenopausal women. So please know that 300 milligrams of oral micronized progesterone is appropriate perimenopausal hormone therapy. Menopausal hormone therapy is not appropriate treatment for women in perimenopause. So it's very important that you understand whether you are perimenopausal or menopausal so that you can advocate for yourself and ensure that you are receiving the appropriate treatment, and so that you do not get treatment that is dangerous or could put you into a system state where you have excess estrogen levels, where we really should be modulating the estrogen. So please have a look at the 9 symptoms of perimenopause. I have put this in my stories as well. I'll just go back and let you know that it says the 9 symptoms of perimenopause. So please know whether you are perimenopausal, whether you have these 9 symptoms. If you're wanting to do a perimenopausal self-assessment quiz, you can do that on my website. It's all the W's. My name is Dr. Kirsty Holland, and I've been in clinical practice for 25 years now, and I am extremely passionate about women getting it right. You need to know which phase of life that you are in so that you can experience and receive the appropriate treatment levels that are not dangerous for you. If you are not menopausal, you should not be receiving menopausal hormone therapy. If you are perimenopausal, you need perimenopausal hormone therapy. And nomenclature and the stage of life that you are in matters. You can't ask for hormone replacement therapy if you are perimenopausal, or hormone replacement therapy if you're menopausal. We need to get nomenclature right. It should be called female hormonal therapy. If you're menopausal, you should be receiving menopausal hormone therapy. And if you're perimenopausal, you should be receiving perimenopausal hormone therapy. And depending on which phase of perimenopause you are in, you should be receiving 300 milligrams of oral micronized progesterone at night to treat the hot flashes, night sweats, mood swings. In Professor Pryor's research, she also shows that she can decrease 40% of the bothersome perimenopausal symptoms that perimenopausal women experience with 300 milligrams of the oral micronized progesterone. So understand where you are at, understand what phase you are in, understand the nomenclature so that you can advocate for yourself, so that you receive the safe hormonal therapy that you need. If that is what you're looking for, have a look at my Substack. I do have 2 articles, or at least 3 articles on Substack at the moment. One is a welcome letter. The second is how do you know if you're in perimenopause? The article is very well researched. All of this research is going into my brand new book that will be published at the end of this year. But please, you have to advocate for yourself. You need to know which cycle of life you are in. You need to know what your symptoms mean and why. And then you also need to understand that if you have not yet gone 12 months and 1 day without a bleed, you are not menopausal, and menopausal hormone therapy is not appropriate for you and could even be dangerous. So please take it easy, know your symptoms, have a look through the 9 symptoms of perimenopause and see whether you are perimenopausal, and please advocate for the help that you need. Take it easy and have a beautiful day.